My overall practice is probably about 30–35% of women who come mostly with bladder dysfunction or incontinence, and the rest are men who come with prostate cancer, prostatic enlargement, incontinence as a result of previous prostatic surgery or neurological injury or illness. In urology, there's a great deal of personal suffering, and it's often very silent and very quiet. It's not something that's visible on the face the way plastic surgical injuries or facial injuries or hand injuries can be. It's not something that deforms the body in an obvious way that draws attention. You can go about your life looking normal, but somewhere deep inside, in a very hidden place, there are very difficult problems that are making your life miserable. This is how I saw urology, and this is where I saw the suffering. I also saw that if operations weren't done well, people could be badly, badly hurt. And I didn't want to see them hurt like that. I thought it could be done better. The surgery is like cutting diamonds. You have one crack at it. And if you don't get it right the first time, you can redo it. But every operation leads to permanent alterations in the body, including various degrees of scar and changes in the natural function of the tissue. Sometimes people have the belief that an operation restores everything to the way it used to be, but in fact what you're really trying to do is to manage and repair problems that have been brought on by age or injury. And so we're trying to get it as good as we can, but there has to be a realistic understanding about what is possible. And so when patients come for the first time and they've undergone examinations, the really important conversation to have with the doctor is what's really going to happen after an operation or after treatment. What's the outcome going to be? What's it going to be like to live with the changes? How would it be if I left it alone? Those are very important conversations to have with people right from the start. For men who have become incontinent after prostatic surgery, usually radical prostatectomy, I can tell them that most of the time their complete problem can be fixed. There can be problems if the patient has undergone radiation or if there's been previous neurological injury or illness. There can be problems if the prostate was obstructed for a long time before the surgery because now the bladder may be somewhat damaged, and as a result it may turn out to be a complicating factor in your treatment. But if your bladder was fairly normal before you had the surgery, if you haven't had radiation treatment, then the chances are your bladder still works fine and all that's necessary is to restore the control. I'm Jacek Mostwin. I'm a professor of urology here at the Johns Hopkins School of Medicine, and I also co-direct the horizontal strand in ethics and professionalism for the School of Medicine.